So all those, all those techniques that you mentioned are really great. But if you lack the motivation to do things like exercising and your mind is racing and things like that, it's very hard to concentrate on distraction techniques.
Exactly.
So I think what we can do is we can try to come up with some coping techniques that are doable right now, that aren't going to overwhelm you or stress you out or add anything to your plate. We can start very small and basic, and we can come up with these together. That way, if something doesn't work, you can try something, and if it doesn't work, we can scrap it, and we can go to the next one on the list, and just see what really works for how you're feeling right now. And these techniques, you can do them anywhere. We can try to do ones that you can do anywhere, and then you can cope with, feelings of overwhelming feelings of anxiety. You mentioned crowds, I think earlier, the holidays, the crowds, things that if you feel like the physical symptoms of anxiety, the racing heart and the shortness of breath, things that you can do to kind of combat those physical feelings, because oftentimes with the anxiety, the physical feelings can kind of like make you more anxious if you're feeling.
Oh yeah. I mean, there were times, in the last month or so, I had such severe chest pains that, I was going to call an ambulance. I thought I was having a heart attack, and I do live alone. So, well then, like I said, on the other side, I'm like, I'm just like, well, if I'm going to die, let me die. Like I said, I feel very discouraged because I was doing well for such a long time. I am going through menopause, and my primary care doctor said that that could be a part of it. So, but it's just hard. Like, I'm trying to do the right thing. That's why I'm here. I am going to meet with a psychiatrist. My doctor recommended that also, to start on antidepressants once again. But I feel like I'm taking, I'm moving backwards instead of forward. Right. And that is very discouraging. That makes me sad. And all I do is cry, God forbid I go watch a sad movie. I'm bawling in the movie theater, People think that there's something wrong with me. I'm just, I'm short. I'm short with my friends and my family. I have no patience anymore.
Right.
I'm angry, but I'm more angry at myself. I'm angry at my depression. I'm angry. I'm angry at my dad, for leaving and not, for not having the relationship. I'm just, like I said, I'm just a big ball of stress. I just, my emotions are all mixed. Right. One minute, I'm sad. The other minute I may be angry. Right. And, it's like a roller coaster. So I'm not at the point that I'm afraid that I think I need to be hospitalized, but I'm worried. I'm very worried. And so are, my family and my daughters, they've seen a difference. And they also urged me to get help. So, and speak to my doctor.
Yeah, it sounds like, the depression and anxiety is really affecting your daily life, your daily, how you go about your daily life, really impacting that. So I think us kind of brainstorming some coping techniques, just to deal with these everyday feelings, might be helpful.
Yeah, I think so. Like I said, I think, I guess I haven't given up all hope, or I wouldn't be here, but it's very hard for me. I mean, like I said, it's just hard getting out of bed, just doing the, basic things like showering and getting ready and going to work. I've called in work a few times. I was able to talk to my boss, which was very difficult, and explain to him what's been going on, and he's been very, very, very patient. He suggested I fill out an FMLA just to protect my job. So I'm trying to be proactive, I'm trying.
Yeah, it sounds like you're taking all the right steps to help yourself, which is great, which is a big deal. So
I know, it's just like I said, it's hard for me to see past this right now.
Right.
I just feel like I've always likened depression to falling into a dark hole, and just trying to climb out of it. And sometimes I feel like I just can't anymore, and that's scary. I do have plans for the future. I do want to travel more. I want to be around for my grandkids. They're young now. I want to be there. I want to, dance at their wedding. I do want to try to learn to deal with this again.
Right. I think you had mentioned self-harm in the past. So I think one of the things we will talk about, if you're comfortable with it, is we'll try to come up with a plan. If you do feel those suicidal urges, we can come up with a plan together.
Okay.
To kind of see, what the next steps will be if you do express, to me that you are having those thoughts. You told me that you're not quite at that point yet. No. But, in case that changes in the future, we can formulate a plan to kind of come up with that and see what the next steps will be. Okay. And I think for now, starting with the coping techniques, will be very beneficial. We can start, like I said, very small and just kind of build up. And after that, I don't want it to be anything that's going to overwhelm you and add more to your plate.
I certainly don't want to feel more overwhelmed. Right. That's for sure.
But they'll just give you. We'll come up with some tools together that we can use that will.
Okay. I would like that.
Okay, great.
Yes.
And I just want to thank you for coming in. Like I said at the beginning of the session, I know it's very hard to talk to someone you don't know, especially about all these things that you're feeling. But it's a great first step coming in.
No, you made me feel very comfortable.
Thank you.
If I'm the type of person, if I feel comfortable with someone, and I did feel like that with you.
I'm so glad.
Thank you so much.
Thank you.
I appreciate you squeezing me in, on such a short notice. So thank you.
Thank you so much, Cheryl. Have a wonderful rest of your day.
Thanks, you too.
Thanks.